Well, my next guest is Sandhya Ramanathan. She's a GP in Grey Lynn, Auckland. Her husband is a surgeon. They're both on the front line. Sandhya works part-time so she can care for their children, and she joins me now live. Thank you for your time this morning, Sandhya. What are the challenges of being a medical family with children in this with COVID-19?
Just as the previous guest was saying, it's actually very challenging. The whole world is facing a new challenge, and we're all trying to rise to the occasion and fight it to the best of our abilities. Doctors particularly are assimilating a large volume of information, and they are at the same time trying to implement practices at work and at home in order to best protect the patients they're taking care of as well as their families.
Yeah, well, let's talk about the family. I mean, you're potentially exposed to the virus every day, I guess. So what precautions are you taking? Just take me step by step through that.
Well, it's pretty simple. We've all been told that we have to stay in our own protective bubble at home. And that means that, you know, you've got to minimise your contact outside of that bubble. In our situation, thankfully, the government has ordered this lockdown, which has simplified matters such that at least our two children, teenage children, are at home, and that's helping the integrity of our bubble. But obviously both my husband and I are leaving that bubble every day and going into high-risk work environments, and so we have to take extra special precautions to make sure that we are not endangering.
Sure. What are those precautions that you're taking?
For example, as we were hearing that, you know, it is still taking time for things like personal protective equipment to feed down. We are hopeful that that will actually happen, but in the meantime, GPs I know are taking it upon themselves to source things like scrubs to wear at work, or, you know, some sort of overalls, etc., to try and protect themselves, because there are a lot of processes. For example, we can't have anything on ourselves that could potentially carry the virus home. So we're taking our phones out of our cases. We're not even taking a pen to work. We're taking everything out of our wallet, and we're just basically, you know, just ourselves alone going into work, and being very meticulous about how we manage between patients, you know, cleaning our hands and, you know, cleaning our equipment, you know, the beds, everything. And then when we leave the workplace, we again have to pretty much, when we get home, have designated station outside the house or in the garage where we basically undress and in a very careful manner decontaminate and, you know, wash our entire body and hair in hot water, and before we can even try and have any contact with anybody at home.
Yeah, so you have to go through all of that, and then how is that changing your interaction and behaviour of the children?
Look, it's challenging. It's been quite a lot to take in, and it's been a lot to take in while we've actually been very busy assimilating all the additional information. We actually have to have time to ourselves to put those practices in place at home, you know, making up those disinfectant solutions and understanding that information. And so obviously we are lucky that our children are old enough to be able to understand that this is very important, but we do tell them to keep their distance.
Yep.
So we are sort of, you know, for example, we're also acutely aware that we are a precious resource, that that we can't afford to be sick, because if we do get sick, then that will increase the strain.
Sure.
On
you were just talking about the extent at which you had to go get scrubs and overalls. Where did you get your overalls from? I mean, are you having to source your own things?
It's actually not much available. So it just happens that my older sister, who lives in Perth in Western Australia, is an anaesthetist, and she's a frontline healthcare worker, and one of her jobs has been getting the personal protective equipment organised, and even they are the doctors are taking money out of their own pocket and sourcing equipment to try and test their masks are working, because everybody is afraid.
So, So have you had to do the same kind of thing? Yeah, have you had to go to somewhere like Bunnings or somewhere else to get a mask, to get overalls?
I to work on Wednesday, and I because I was pointed out that even if I'm taking my scrubs off, I should have an apron on the front to cover myself, so that as I'm taking my scrub off, I'm not going to contaminate my face if there's any COVID on the front. So we've just bought some painting overalls to put over our scrubs, so that at least the front is protected, and we just take that off and at least reduce some of that viral load, I suppose you can say, when I get into my car, because unlike hospitals, general practices don't have showers or, locker rooms where you can basically change. So it's a bit of a logistical nightmare, and people in primary health are trying. And I think that's one of the problems, is that we haven't received, a good directive to say exactly how we can protect ourselves. So not all GPs are wearing masks, and yes, there is a shortage of personal protective equipment, and obviously the hospitals are always prioritised, and fair enough that they are on the front line, but currently a lot of the cases, the front line is actually in the community, and a lot of patients are asymptomatic. So just as we've been advised to act as if you have COVID, we have to assume that every patient has COVID, and that we potentially could also have COVID, and we just may be asymptomatic. So, I mean, that does pose challenges when you are...
All right, well, look, best of luck for the next 4 weeks and for the rest of the year. GP Sandhya Ramanathan, thank you very much for your time.
Thank you. Thank you very much.